Started with a mammogram, which showed nothing. Then saw my physician, my gynecologist, who was doing a manual exam and said, "I think I feel a lump." So we went back for a second mammogram, still nothing, and then an ultrasound and found a lump. So after the biopsy, when you heard the word cancer, that it was pretty scary. I really believed at the time that it was going to be nothing. That they would say, "Oh, well, it's a mass, we'll watch it for a few years and it's probably nothing." But after the needle biopsy and getting the cancer diagnosis, that's when it got scary. Was first diagnosed, I was within another medical system because that's where my physician is, and felt like I wanted to get a second opinion because I wasn't sure about my options. And so then that's when I came to see Dr. Edney at the Med Center and first became aware that there were treatment options that I wasn't aware of.
Women have two surgical options basically when they have breast cancer. One potentially is breast conservation, where we do a lumpectomy, leave the breast behind, sample a lymph node in the armpit, or sentinel node if you will. And then in order to get the same kind of long-term results that we could expect to get from mastectomy, they have to have radiation therapy. Conventional radiation therapy is once a day, 5 days a week for 6 weeks, and so 30 treatments. This creates a real problem for people depending upon their schedule, the geographical barriers that are associated with it, especially when you live in an area like Nebraska, that it's largely rural. A woman might have to drive 250 miles round trip every day for a radiation treatment for 30 treatments. And what the Intrabeam device is a unique way of delivering all the radiation that a patient needs for the treatment of the breast cancer in one treatment to the tumor site in the operating room. And the way this is done is that the surgeon goes in, removes the tumor. There's a cavity, if you will. You select an applicator that's appropriate for the size of the cavity, and usually it's anywhere from about 3 to 5 centimeters. And it's placed into the cavity. It's hooked up to the device, and all the radiation is delivered at the time of operation. It usually takes anywhere from about 25 to 40 minutes to deliver the radiation. So what we can accomplish in one session of approximately an hour to hour and a half of operation and radiation would normally take 12 weeks using conventional treatment.
It sounded really good. I said, "Sign me up." Since that time, recovery's gone well, healing has gone well. It turned out I did need chemotherapy, which I've started now, but if I hadn't had the intraoperative radiation, I would have looked at surgery, recovery, chemo for 12 weeks, then additional 6.5 weeks of radiation, and it would have really stretched out that whole treatment plan. So I'm happy the radiation's behind me, and now it's just the chemotherapy that I'm working through. Essentially, the radiation and surgery worked. There's no cancer today, but it's just the chance of recurrence that we're treating now and trying to minimize those chances.
I think it's cutting-edge technology. It is based upon good clinical research, and I think that's our responsibility as a NCI-designated cancer center to be able to provide those kind of options which might not be available someplace else.
Because I honestly didn't have any idea about Intrabeam as an option, and I wouldn't have known if I had stayed with my original healthcare system. And it was really by saying, I'd really like to have a second opinion, and I came to Dr. Edney through a referral from a friend who was very pleased, and I was so excited when I heard that there was this option because I had no idea, and it made a huge difference for me.